Lung cancer is one of our biggest problems in Yorkshire. It unfortunately takes the lives of almost 3,000 people every year, and it's something we're dedicated to tackling. The Yorkshire Lung Screening Trial, also sometimes known as YLST, is designed to find lung cancer as early as possible. So people in Leeds will be invited to something called the Leeds Lung Health Check as part of the trial, where they'll be invited to undergo a CT scan. CT scans are very good at finding lung cancer at a very early stage. And if we can find lung cancer at an early stage, we can treat it and hopefully save those people's lives. So the Yorkshire Kidney Screening Trial, also known as YKST, came about because we were finding a lot of kidney cancers when we were scanning the lungs, because the CT scanner picks up just the top half of the kidney. So the charity spoke to some kidney screening experts and developed a plan with them to scan the entire kidney to figure out in the future if a full lung and kidney screening trial would be possible.
YLST invites patients to have a lung scan at the start of the study and again 2 years later. And YKST is inviting patients into the study when these patients come for their second lung scan. When these patients come to the van, they are told about the study and they are shown a video that tells them all about YLST, what's happening in this second visit, but also what's happening in the YKST study.
They go and have their scan on the van of the chest, and then they'll have their tummy scanned at the same time. It just adds a few seconds onto the scanning time.
So these scans are then sent from the van to the Leeds Teaching Hospital systems, where they would be seen by the radiologists who would look at the scans and write a report, and then if there were any findings, they would then send them on to the relevant clinical care teams.
When I first received my invitation letter from the Leeds Lung Health Check, I thought, oh, that's good. When I was a young woman, I used to smoke, so I thought, good, that'll be a good thing to do. And I heard very quickly about the kidney scan. I think it was less than 2 weeks, and was very pleased that it was clear. And it wasn't just for cancer, it was for if there was any other signs of problems in your kidneys.
If there's been a finding, the most likely things are going to be urology problems like kidney cancers. Those people will automatically go into the appropriate pathway within the hospital that would happen as per any normal care.
So there are a number of things that we're hoping to find out from the Yorkshire Kidney Screening Trial. So firstly, we'll know whether how many people take up the offer of the scan. And that's important because in any future screening trial, the study only works, we can only save lives if people turn up for that screening. And so by understanding how many people turn up and why they turn up and why they don't turn up, we'll potentially be able to make changes to how we're running the programme and the information that we provide people with.
My attitude is, if you can get treatment like this, then why wouldn't you know, so that then something can be done about it?
The Yorkshire Kidney Screening Trial is a real collaborative effort, and there are quite a few organisations involved in actually making this happen.
Yorkshire Cancer Research, our generous funders, were really interested in this concept right from the beginning as an additional benefit to the Yorkshire Lung Screening Trial.
Yorkshire Cancer Research would like to see lung cancer screening rolled out across Yorkshire and the rest of the nation. But equally, if we can find a way to combine lung and kidney screening together, we'll be able to save even more lives, and that's our ultimate aim and vision.
And now, through the research on my lungs and the scans for the kidney research, I've been directly helped by Yorkshire Cancer Research charity.